Governor DeWine's announcement is posing questions from a medical standpoint.
Chief among them, how risky is this move, and is it too soon?
Chris Serenelli consulted with some of our local doctors and experts and has their reaction. Chris?
Aaron and Derek, good evening. Yeah, the doctors I talked to say that although the governor's June 2nd target date to lift most of those health orders misses the case mark that DeWine himself initially set, it does give folks who haven't gotten their shot time to do it. They say that's critical because people are still getting sick and still dying. The Valley's medical community sounded off Wednesday night about Governor DeWine's plan to lift most COVID health orders on June 2nd. Cautious optimism perhaps best described their reaction.
It's not over.
Mercy Health Chief Medical Officer Dr. James Kravick called the plan a positive step. He hopes the public will temper the celebration with discipline.
As these variants do continue and as they mutate, they will continue to change. And so, that's why we must vaccinate to reduce the spread, because the more they change, those that have been vaccinated might be at risk because the mutations are out there.
Infectious disease specialist Dr. D. Banks agrees that the June 2nd milestone may not be too soon, but says that it does fall short of DeWine's goal of 50 cases per 100,000 Ohioans. Right now, it's 132 cases per 100,000.
3 weeks gives us an opportunity to step up our game, get vaccinated, get our children vaccinated. I would still recommend those individuals that are going to be in an indoor situation with people over, 10 to 15 people to still wear a mask.
Both doctors say that's an example of the personal responsibility the public has to take. They stress the vaccines are the only way to reach herd immunity, not just in the U.S., but around the world. But with every shot in every arm, the news is getting better.
Now we're top of the ninth.
Top of the ninth?
Visiting team is batting, and we're 1 out.
Reporting with more local news, I'm Chris Serenelli.